Your liver makes most of the cholesterol in your body, not your breakfast, your liver. It produces somewhere around 80% of it every single day, whether you eat cholesterol or not. I start there because it explains something that frustrates a great many people. You cut out eggs, you switched to skim milk, you stopped eating red meat, and your number barely moved. That is not a discipline failure. That is biology. Because if you want to lower cholesterol with food, guessing at what to remove is the slow way. The fast way is understanding one specific system in your liver, and then eating the foods that force it to work in your favor. That is what this video is about. I am going to give you 7 foods, each one with published trial evidence, and I'm going to tell you roughly how much each one moves the number. And near the end, I'm going to say something about statins that I suspect you have not heard a doctor say out loud. Let me explain the system first because everything else depends on it. Your liver produces a substance called bile. Bile is made out of cholesterol. Its job is to be released into your intestine to help digest fat. Now, here's the part almost nobody knows. Your body does not throw bile away. It reabsorbs roughly 95% of it further down the intestine and sends it back to the liver to be used again. It is a recycling loop and it is remarkably efficient. So think about what happens if you interrupt that loop. If bile leaves the body instead of being reabsorbed, the liver has to make more. And to make more, it must pull cholesterol out of your bloodstream. That is the lever. Several of the most effective cholesterol-lowering foods work by breaking that recycling loop. They do not block absorption of the cholesterol in your food. They force your liver to spend the cholesterol already circulating in your blood. Now let me give you the foods, and I am going to start with the strongest one, which is also the one almost nobody mentions. Number 1 is psyllium husk. You may know it as the main ingredient in Metamucil. Most people think of it as a laxative, but its cholesterol evidence is considerably stronger than most of the foods that get the attention. A meta-analysis published in the American Journal of Clinical Nutrition pooled 28 trials with over 1,900 participants. At about 10 grams a day, psyllium lowered LDL cholesterol by an average of 13 milligrams per deciliter, 13 points from a fiber. The typical study dose is around 5 grams taken twice a day before meals. And there is one finding I find particularly interesting. Researchers have tested psyllium alongside statin medication, and the effects add together rather than overlapping. In one study, a lower statin dose combined with psyllium performed comparably to double that statin dose alone. That is a conversation worth having with your doctor if you are trying to manage side effects. 2 practical cautions. Start with a small amount and build up over 2 or 3 weeks, or you will be uncomfortable. Take it with a full glass of water, never dry, and separate it from your medications by about 2 hours because it can interfere with absorption of some drugs. Number 2 is oats and barley. Same mechanism, different food. The active compound is a soluble fiber called beta-glucan. Meta-analyses of randomized trials have found that at least 3 grams of oat beta-glucan a day lowers LDL by roughly 10 points, with no meaningful change to HDL or triglycerides. 3 grams is about 1.5 cups of cooked oatmeal or 1.5 cups of cooked barley. And the effect was consistently larger in people who started with higher cholesterol, which is a pattern you will see repeatedly today. The higher your number, the more room there is to move. Steel cut and rolled oats both work. Instant oatmeal packets work too, but many are loaded with sugar, so read the label. Number 3 is beans and lentils, a serving a day, roughly 1/2 cup. They provide viscous fiber for the bile pathway, plant protein instead of animal protein, and plant sterols, which I will explain in a moment. Analyses of randomized trials have generally found LDL reductions in the range of 5% from regular legume intake. That may sound modest, but this is a food that costs almost nothing, keeps in a cupboard for years, and also lowers blood sugar and blood pressure. I do not know of a better value in the entire grocery store. If this is useful to you, tell me in the comments what you had for breakfast this morning. I read them. Number 4 is nuts. About a handful a day, which is roughly an ounce and a half. Almonds and walnuts have the most trial data. Nuts work through several routes at once. They supply unsaturated fat that replaces saturated fat. They contain fiber, and they naturally contain plant sterols. Now let me explain plant sterols because they are the second major mechanism after the bile loop. Plant sterols are compounds in nuts, seeds, and vegetable oils that look almost identical to cholesterol in their molecular structure. Because of that resemblance, they compete with cholesterol for the same absorption channels in your intestine, and they crowd it out. At around 2 grams a day, LDL reductions of roughly 10% have been reported. The honest caveat is that 2 grams is difficult to reach from ordinary food. Reaching the studied dose generally requires a fortified product such as certain margarine spreads or fortified orange juice. Look for the words plant sterols or stanols on the label. Number 5 is avocado, and this one has a detail that surprised me. In a randomized controlled feeding trial published in the Journal of the American Heart Association, 45 adults with elevated LDL ate 3 different cholesterol-lowering diets in random order. One included a whole avocado daily. Another used high oleic oils carefully matched to the exact fat profile of that avocado. So the fats were the same. The avocado diet still lowered LDL more and had a particular effect on small, dense LDL particles, which are the subtype most prone to oxidation and considered more damaging to the artery wall. A later analysis found it also reduced oxidized LDL. So there appears to be something in the whole fruit beyond the fat alone, likely its own fiber and plant sterols. A recent meta-analysis of 10 trials confirmed a significant LDL reduction while finding no meaningful effect on triglycerides or HDL. 1 avocado a day is a lot of avocado for most budgets. Half is reasonable. Number 6 is soy. Tofu, soy milk, edamame, tempeh. Soy protein appears to act on the liver's own cholesterol handling rather than on absorption, which makes it a genuinely different mechanism from the others on this list. The reductions in trials are modest on their own, but it stacks with everything else. And number 7 is fatty fish. Salmon, sardines, mackerel, herring. Now I need to be precise here because this is widely misunderstood. Omega-3 fats are not primarily an LDL treatment. Their strongest and most consistent effect is on triglycerides, which is a different number on the same lab report. At high doses, they can lower triglycerides substantially. They can slightly raise LDL in some people. So if your triglycerides are high, this matters enormously to you. If your LDL is the problem, fish is a good food, but it is not the lever. I would rather give you the precise version than the flattering one. Now, here is what happens when you combine these. Dr. David Jenkins at the University of Toronto tested exactly that combination and called it the portfolio diet. In a controlled research setting, it lowered LDL by around 30%, comparable to a starting dose of a statin. But in real-world studies where people simply ate this way at home, the reductions were closer to 13 to 17%. I want you to hold the second number, not the first. 13 to 17% is genuinely worth having. It is not 30. And anyone quoting you 30 from a home kitchen is quoting the lab. Now, the thing about statins I promised. I have watched a lot of patients treat needing a statin as a personal failure. They come in embarrassed as though the prescription is evidence they did not try hard enough. So let me say this plainly. Your cholesterol level is substantially inherited. Some people's livers simply manufacture a great deal of cholesterol and reabsorb bile with unusual efficiency, and no amount of oatmeal changes that genetic setting. There is a condition called familial hypercholesterolemia that affects roughly 1 in 250 people. And those patients can eat immaculately and still have dangerous numbers. Needing medication is not a verdict on your discipline. And please do not stop a statin because of this video. If you have already had a heart attack or a stent, stopping is genuinely dangerous. And that is a situation where I have seen the worst outcomes. The right frame is that food and medication work together and the effects add up. If you want to try lowering your dose, that is a completely reasonable conversation to have with your doctor, followed by a blood test in 6 to 8 weeks to confirm it actually worked. That is entirely different from just quietly stopping. 3 honest statements before I close. Individual response varies a great deal, and some people will see half of what I quoted, and some will see more. Give any change 8 to 12 weeks, and then measure rather than guessing. And this video is education, not medical advice. I am a physician, but I am not your physician. One last thing, and it is the most useful sentence in this video for some of you. There is a form of cholesterol called lipoprotein(a) that does not appear on a standard lipid panel. Roughly 1 in 5 people has an elevated level. It is almost entirely genetic, and neither diet nor statins meaningfully lower it. You have to ask for it by name once, and then you know for life. I made a separate video about it, but if you take nothing else from today, take that. Tell me in the comments if you have ever tried psyllium. I suspect most of you have it in a cupboard already and have no idea what it does. Take care of yourselves, and I will see you in the next one.